A big story this past week. Buffalo Bills player Damar Hamlin's collapse on the field. Doctors treating Hamlin saying he's making dramatic improvements after suffering cardiac arrest on the field earlier this week. After this medical emergency on the football field, many health experts pushing for greater availability of automated external defibrillators, or AEDs. A recent study reviewed 50,000 cardiac arrests outside of a hospital, noting only 19% of those patients were shocked by a bystander using an AED. It showed people who had a shock by an AED had a 56% improved chance of surviving than if they were just waiting for EMS. Dr. EvanLevine is a cardiologist and is with us now. Doctor, welcome, and thanks so much for coming on. What do you make of that report and the importance of AEDs?
I think AEDs are incredibly important. You cited the literature. They save lives. We saw this at the Bills game. I mean, this is a public figure, and I think we should use that to encourage the states that don't mandate AEDs in schools and health clubs to do so. Their cost is only about $2,000, and it's very simple to use, self-explanatory, and again, it can save lives. We have 350,000 events a year in this country. So there are a lot of lives to be saved. And when we look at Mr. Hamlin, he's probably going to walk out of the hospital, thankfully, because of the people that were around him and because he was defibrillated.
It was an immediate response time, right? We saw the EMS emergency crews come onto the field. They were willing to assist. How difficult is it to operate one of these machines? Can anyone be trained in learning how to do so?
It's quite simple. I mean, it's self-explanatory. It tells you what to do. Literally, a 5-minute video would be enough for many people to know what to do. And folks that work at healthcare clubs, even doormen in large buildings, a half an hour, maybe a year in training is probably more than enough. And imagine how many lives we can save with just that simple push of a button just to start that defibrillator and then allow it to tell you what to do.
Right. Again, maybe just checking in with your gym or your health club or even your kids' soccer match to see if you've got any available at the facilities, just in case something like this were to happen. You'd never want to see it, but again, just in case. Dr. EvanLevine, thanks for joining us today. Thank you.
Thank you so much.